Hi, welcome back. Last week I uploaded a video in which I interviewed Dr. Joy Kong, a triple board certified physician, certified in psychiatry and neurology, addiction medicine, and anti-aging and regenerative medicine, who was also recognized as the Stem Cell Doctor of the Decade in 2021. If you missed the interview with Dr. Kong, you have to watch it. It is fascinating. I will link it down below. When Dr. Kong and I talked, we talked for an hour and a half. I could have talked to her for days. It was so incredibly interesting. But of course, I didn't want the video to be forever long. So I broke it into two parts. So last week's video was on stem cell therapy. Today we are talking about peptide therapy. And again, the incredibly regenerative and anti-aging benefits of peptide therapy. So without further ado, let's talk to Dr. Kong. You just mentioned peptides, and that is something else you offer in your clinic is peptide treatments. And it's something I'm very curious about. I actually just recently had a consultation with one of your colleagues on peptide therapy, and it's something I'm going to try. But tell us a bit more about peptide therapy. Why is it so exciting? What can you do for us? What sort of peptides are out there? I have 1,000 questions.
So I think of peptides as nature's existing pharmacy, really. Stem cells, of course, cells secrete these peptides, different cells. These are molecules that have profound effects and targeted effects for your body. Over 300,000 types of peptides. We've uncovered about 7,000 of them, the ones that we know of the sequence and, know a little bit of what they do. But imagine all these molecules simultaneously floating around your body. They can go to a specific organ. Many of them are very organ specific. They will go to a specific organ, like a lock and key, and turn something on and help with the repair process. So all these are, very powerful. But as we age, the amount of peptides do decline. I think partially is, the aging process, the damage of the cells, but also the nutritional lacking and our inability to make enough enzymes and peptides and, just different proteins. So just a slow kind of, so almost like sapping of life energy, right? We're just getting less and less and less of what we need. So we can replenish. So at least if now we know that somebody has a specific issue. For example, somebody has muscular tendon tear. So we want to target the tendon. So what peptides could be very helpful for that repair? So some commonly used ones will be BPC 157 and TB 500. So these are very helpful for muscular skeletal system, but they're great for other systems too, for the brain. So these two are like, I call the peptide kind of like a key, right? You go and then you unlock things. But BPC 157 TB 500 is like a keychain, right? With 100 keys on there. So you go around and all these different organs. Oh, here's a keyhole that I can open up. Here's another one. So it can turn on a lot of things in your body. So those two are great for your immune health, for your brain health, your cardiovascular system, your, of course, musculoskeletal, and BPC is great for gut health. So those are really nice overall. I consider them anti-aging peptides because they can elevate the repair in so many systems. But something like ipamorelin CJC 1295 can also help with musculoskeletal repair. I mean, they improve the level of human growth hormone. So the growth hormone will help with all organ repairs. So every organ, right, including your skin. That's why a lot of people taking growth hormone, they're looking better, they're looking younger. So really depends on what we're trying to target, which is a really nice tool to have, because when I give stem cells, it's kind of a broad, I'm sending these incredible soldiers into the body and they're doing everything. But if somebody has a specific issue, it would be so nice to be able to target. If we know the immune system is lacking, that there's, autoimmune tendencies or there's an infection going on, there are peptides that are really helpful for that. So then I can give an extra signal, extra help. And that's when I realized it's very nice to to bring into my clinic so I can be more effective. And I do believe, peptides is a huge part of the future of medicine. Instead of pharmaceutical companies sitting at their desk, in their labs, trying to develop new molecules, how about we just find out what the body has? What the body might be lacking. Everything is in there. That's why I mentioned spontaneous healing. Everything is there. Maybe the essential ones are not there anymore, but it was there. So why don't you just give it to people? So once that comes into light, then I think peptides could replace maybe 60-70% of medications, because we have something the body already has that there's no side effects if you're giving the body appropriate amount, and there's no interaction, since the peptides have been with you throughout evolution. It's adapted with you, it's part of you, and there's no side effects, no interaction with other peptides. That's why you can put different peptides into one vial and inject it. They're not going to interact. They don't interact in your body. They're not going to interact in a syringe. So yeah, so that's the new way of doing medicine, is to tap into the intelligence the body already has. It has, everything, it has made it for you. But can we tweak it? Yes, I trust in, I do believe that human intelligence sometimes can make some really interesting things. One example is ketamine. I do utilize ketamine in my clinic sometimes. This is a man-made molecule, but has profound effects as an anesthetic and as a healing tool for people with mental health issues. So it has some psychedelic properties, but it's man-made. So am I going to discount this molecule just because it's man-made? No, it's a very safe molecule when used responsibly and appropriately.
Now, just to backtrack a little bit, you just mentioned ketamine is man-made, and you also said that these peptides are naturally existing in our body, but the ones we are injecting, or you're injecting in your clinic, are those synthetically made? How are they derived?
Yeah, the reason that peptide therapy could become something that's so popular and so big is because we found a way to synthetically make what nature already has, right? So it's a chain of amino acids. So if we know the amino acids and we have the building block, people have taken amino acids, right? We know the amino acids. So we can string them together with a efficient process, then we can mass produce. So that's what's going on. It's a natural sequence that has been mass produced. There are some peptides that there may be slight modifications made to enhance its absorption, to enhance certain actions. So people have tinkered with the peptides, but for the most part, the majority of the sequence is existing in nature.
Okay, so these are synthetically made; they're not human derived, but they mimic what we already have in our body.
Yeah, some are derived from animals. For example, cerebral lysine. It's really a group of peptides from the pig's brain. So those are extracted from pig's brain. So it's not a single peptide that's sequenced in the lab. It's something that they just made an extraction of. So you have this wide range of different peptides.
Now, I'm going to start with my peptide therapy, but tell us a little bit, what does it look like? Is this something it's something we inject subcutaneously? But is it something that we're going to do for the rest of our life? Is it something that we're cycling? Are we taking a whole bunch of peptides together? Tell us a little bit about what does it look like if somebody starts with, of course, it's going to depend probably what peptides they're going to use, but tell us just a little bit about what is it going to look like somebody actually using peptide therapy.
So we have probably about 21, 22 peptides in our clinic. I've used them all because they all sound amazing. And I just, of course, I want to try them and reap some benefits from it. The general, again, we're talking about the practice of medicine. No one knows for sure exactly what's the proper, timeline and regimen. But the conventional wisdom is that you take a peptide for 1 to 3 months, and then you take a break. You let your biological system kind of readapt so you don't bombard the same receptors, day in and day out. So that's just conventional wisdom. How much of that is necessary? I'm not even sure. Maybe I can take it every day, but the conventional wisdom is that you take a break. If there's research stats showing, I would love if someone wants to comment, if they've seen research studies of the difference between pulsing versus continuous, that's great, but I haven't seen anything yet. So different forms have different length of how much you need to take it. For example, the most obvious exception is epitalon or epidolon. So this is a pineal peptide that you probably, if you don't have significant cardiovascular issue, probably once every 6 months is enough, just for 15 days. Although if you have severe cardiac issue, maybe you can do it even once a month to really get the healing to a deeper place. But the maintenance is once every 6 months. So that goes into the category of bioregulators. So bioregulators are also peptides. They're just really tiny. They are 2 to 4 amino acids long, and they're so small that they are able to cross the cell nucleus and interact with the DNA and repair the DNA. So it's pretty amazing, like we'll have these molecules that can do that. So that's what epitalon is able to do, because it can repair your DNA. So the effect is very long lasting. Epitalon, I say I think anybody over the age of 35, 40 should take epitalon, because it extends your telomere, and then it rejuvenates your cardiovascular system. So it greatly reduces your chance of mortality and morbidity, and it reduces your chance of all form of age-related pathologies, including cancer. So basically, it's the anti-aging agent. And a really interesting research they did was they did 79 patients. They were all age 60 to 69, and they all have coronary artery disease. And when they gave them the epitalon once every 6 months for 3 years, so they only got 6 sessions, but they followed them for 10 years. At the end of 10 years, the people that got the epitalon, their cardiovascular system was 9 years younger than people that never got it. And the chance of them dying from cardiovascular disease went from 83% to 46%. So that's a drastic reduction in protection for your life. So I just don't see why we wouldn't do it. Just take it. It's better than any insurance you can buy, right? So you just don't get sick.
Yeah. Wow. So that one is your favorite, the epitalon?
I think it's very important. Yeah, I definitely like that one. BPC 157 TB 500 is fantastic. Accelerates healing. Like I know a friend who fell off a ladder, broke several ribs, and he's about 80 years old. So his doctor at Kaiser said, well, it's going to take 6 months for you to heal. So I said, here, these are the peptides, BPC 157 TB 500, take it every day. I think he only took 1 round. Yeah, only 1 round. That was 20 days. And within 2 months, everything's healed. I mean, This is 80-year-old. So he was, not supposed to be fully healed for 6 months.
That's incredible. Tell us about some other peptides that you really like and that you've seen good results with.
Ipamorelin, CJC1295. So that's a really nice set for enhancing growth hormone production. Of course, that's rejuvenating. It can be helpful for people that have some sleep issues as well. Maybe not everybody, but definitely I've seen it helping people sleep, helping with weight loss, just making your body probably tighter, less fat, more muscles, and just a body recomposition. So that's a nice one. Tesamorelin achieves similar results, and that's a really nice one as well. So those I personally like. And then the other ones that I like, so C-Link, C-Max are really cool because they are neuropeptides. So C-Link helping with anxiety, some depression as well, neuroregeneration, and C-Max great for concentration, cognition, so good for ADHD symptoms. So those are really nice to have. A GHK copper, which is one of the peptides I put into the cream. It's a very famous peptide for skin rejuvenation or even hair, but it's also great for nervous system, for your central nervous system health. People probably don't know skin and nervous system, they're all ectoderms. So they're, 3 germ layers. So they're all in one camp. So sometimes things good for skin are good for your brain. So the GHK copper, is really good. You can either inject it or use it topically. And PT-141 is a fun one because it's a sexual peptide. It targets your central nervous system, not quite exactly targeting peripheral tissue, but people do get much better erection, arousal from taking the peptide. So that one you can use nasal form or injection. So that one is kind of nice because people get, just better sexual arousal and also, better quality of orgasm. So that's a nice one. T-alpha 1, very popular, helping with immune health. If somebody has chronic fatigue, with autoimmune diseases, with chronic infection, it can be very helpful. There are also some other weight loss peptides that I like. Semaglutide is probably one of my favorites. Some people get side effects, so you do need to be a little bit more careful, start titrating up slowly. Otherwise, people can get, severe nausea, no appetite, constipation. So those are potential issues. But how effective it is as a weight loss agent it has been unseen, to melt fat away and to reduce appetite and improve your blood sugar metabolism. So that's amazing. And of course, that's the one that's been made famous by Kim Kardashian, the whole Kardashian family.
Oh, so that's Ozempic.
Yes,
okay.
It's Ozempic. So semaglutide, because of the popularity that they brought on, it's in short supply. So that one I do like, and I do use it sometimes. It definitely reduces your appetite. So I think that's a really nice tool to have for people that are struggling with blood sugar. A lot of people who are struggling with weight are really struggling with blood sugar metabolism, and besides inflammation, blood sugar metabolism and appetite regulation. So semaglutide can be a powerful tool. There's some other ones that can help with weight loss as well. So like MOTS-c, there's 5-amino-1-MQ, which can help with an AD and mitochondria health. Of course, you can always use the growth hormone peptides to help with weight loss, like tesamorelin and ipamorelin, CJC. Yeah, those probably are some of my favorites that I use more frequently. It really depends on people's specific needs. There are bioregulators as well that are becoming popular, but there seems to be very few companies that provide that, but those are targeting specific organs, which I've added on as an extra push for particular organ repair.
So you mentioned, I believe it was C-Link, that can be beneficial for anxiety and depression. So is that something that could possibly replace medication for people?
I think there's a possibility, but I think just relying on one peptide, again, is a reductionist approach. You have to look at why people are anxious and depressed. So many times it's because there may be inflammation going on. There's brain inflammation. Maybe they don't have enough minerals in their body, that the signaling is faulty. Maybe they don't have, certain amino acids, to build proper enzymes and protein. Maybe they're toxic, they're having some heavy metal or some organic toxins in their body. So just relying on one thing, it's that will be falling back onto the allopathic, pitfall. I think, can it be very helpful? Yes. I still think pharmaceutical drugs has a place. I was a psychiatrist. I don't identify as being a psychiatrist anymore, but I've given a lot of people psychiatric medications, and I've seen the difference it can make, how it can improve their quality of life, kind of taking them out of a very dark place. But I think, acutely helping people is different from what you can really do to truly heal them, so they don't have to rely on this medication. Because really, like the joke in the integrative space is no one is deficient in Prozac, right? Nobody's born deficient in a particular medicine. So you want to address all the underlying causes. But yeah, I think it'd be a really good tool. So for depression, there's one peptide called PE2228, and that can take people out of depression very fast, I think within 72 hours. So that, as compared to traditional medicine, medications would take about 3 weeks, 2 to 3 weeks to take effect. So it could be, yeah, so it's exciting, right? That you can have something that works even faster than medications.
Yeah. What about for PTSD? Would those peptides be helpful for that?
I have not seen that. I think PTSD, that's more of a brain wiring issue. And I've seen ketamine therapy as being very powerful. That's probably I think psychedelics is probably one of the most powerful modalities for PTSD. I think we really need to accept not everything is biochemical. Some things could be biophysics, could be on an energetic level. I think human consciousness needs to evolve to embrace that. We've been very much kept at the level of what I can see is what there is. We've moved on to what we can measure physically, which is still what you can see, the needle moving. Okay, all right, there's electricity, even though you can't see. But we've got to move beyond that. And I think we're in the middle of this revolution. People either want to get stuck and not learn more, or they embrace the change in human consciousness and try to understand more of who we are. I think trauma can change the energetic, probably wiring of your brain. And you need to work on that particular level because we still don't know. How does ketamine move people beyond trauma? Like what's going on? For example, I know this patient, he had PTSD because his dog was run over by a truck, his beloved little dog, right? So he was so traumatized that he could not even mention the name of his dog without sobbing. And he had an urn, of the dog, and he couldn't even look at it. He couldn't touch it, couldn't look at it. But after the ketamine treatment, he was able to take that out and take out the little paw print that's inside the urn, and then made a tattoo and put it on his body. He's moving beyond trauma. We are going to have trauma in life, period. That's part of human life. But do you have to be stuck in trauma? Or can you still enjoy what life is, even with trauma in the past? So that's what these substances are allowing us to have, is to move beyond. And why is it and how? We don't know exactly why and how. One hypothesis is that it slows down your brain perception of what you are observing as far as the trauma. It slows everything down. So instead of this quick loop of trauma and hyper alert and sympathetic response, you're able to see, oh no, there's another way of looking at this and thinking about this. All of a sudden you're bypassing that loop. So that's one hypothesis. And I think, I don't think peptides is going to be able to do that. Yeah.
So we need a whole nother video on ketamine, sounds like.
Possibly. That's why I'm incorporating all of them. It's so funny. I tell people, I said, I've done, at that point, I had not introduced ketamine yet. I was looking into it. But I was dissatisfied with certain aspects of stem cell therapy because what I say was, if a person came to me and the person was an asshole, and no matter how much stem cells I pump into his body, he's still an asshole. So, and it's not until I can introduce some ketamine, something that take them out of this control, this ego, cluster, then they're able to look beyond. They're not captured by their ego anymore. And then actually they become much nicer. So that is a transformation just by giving cells is not going to bring about.
Now, going back to the ivamorelin, that is something that we use now instead of growth hormone injections, correct? So years ago, growth hormone was directly injected, and that's not really something that's done any longer, to my understanding.
I do prefer that. I think it's a much more natural way of getting growth hormone levels improved, especially when you look at human growth hormone. They are producing a particular sequence of human growth hormone, and that is the one that they are giving people for injections. But there are all kinds of isoforms of growth hormones. So there are many, many variations. Nature is abundant, right? Nature is varied. So your body may produce a couple hundred different types of growth hormones. They're all slightly different. So if you bombard your body with one type, first of all, you can easily raise it above physiological level. And that's why people can get diabetes type of problems, cancer. They can't, their fingers, nose, can start to change shape. So those are the side effects. You overshoot. But if you give your body something like the secretagogues, so those are the growth hormone promoting peptides, like ipamorelin, CJC, tesamorelin, you are telling the pituitary to secrete more growth hormones. And the pituitary, of course, is going to secrete a whole slew of growth hormones, what the body recognizes and what's natural. And it's never going to secrete more than what you need. It's not that dumb. There's this mechanism that keep the body at an equilibrium. When you put the growth hormone itself, then your body don't have a way of overriding it. But if you put a hormone that tells the organ to produce more growth hormone, the organ is never saying, oh my God, you're giving me so much signal, so I'm just going to keep pumping it out. It doesn't really happen that way. So you are maintaining a more natural balance of the growth hormone. Yeah, so I like that.
Okay. And it sounds like there's also no feedback loop, unlike with growth hormone.
Right.
So it's not that the body just turns off production.
Right. We haven't seen the feedback loop with the peptides. It's a different type of mechanism.
So for me personally, I broke my neck 10 years ago. And I do have a double neck fusion, but I do have a lot of musculoskeletal issues because of that, because my neck is just constantly guarding. So that's something I'd like to address. I'm sure there's quite a bit of inflammation there. I had mold illness last year. We lived in a very moldy apartment, and both my dog and I got very sick. And I have recently tested my mold levels again, and they have come down, but they're still too high. So that's something I'd like to address, that inflammation that mold has caused. I also had a vaccine injury from the COVID vaccine. So there's quite a bit of inflammation in my body, and that's something I definitely would like to address with peptides. And then just general anti-aging would be lovely.
Yeah. So for situations like that, for your immune system issues, with the mold and the vaccine injury, probably boosting your own immune health would be really good. So that would be the thymus peptides. So that's thymosin alpha-1, the TB500, which is T-beta-4. So those would be very helpful. And then for musculoskeletal, I think something like the BPC 157, TB500, and the growth hormone set will be really helpful for you. Yeah. So that's the beauty of working with peptides, right? So you can give me something specific we can target. Of course, we can always inject stem cells, which are very powerful as well. I've met with a doctor, this is a few years ago. He's a peptide expert. He started his own peptide company. But even for him, who has Lyme disease, who is using all these peptides, there's a plateau that he reached as far as how much healing he could get. You can put all these things in, but if your body doesn't have this deeper wave of healing, it's not getting him where he wanted to be, because he was still overweight. He was very fatigued. His cholesterol level was very high, and he would, wake up late in the afternoon, 2 p.m., right? Waking up, dragging his feet, some days barely able to finish a few emails. So that's where he was at before I introduced stem cell therapy to him. So this is an example of why I use different modalities. So somebody who's an expert at hormones and peptides and everything integrative, all these, vitamin C, all these infusions, did everything. But it's not until the stem cells came in that he had a transformation. The cholesterol went down from 300s to normal within a month or so, and lost 30 pounds because finally he had enough energy to work out. And it was a transformation. So that shows you don't want to rely on just a single modality, because the body is very complex. I think cells can accomplish things that very few other just molecules are able to accomplish. So that's why I'm so passionate about stem cells. But it's certainly nice to have peptides as an extra tool.
Now, you just brought up hormones. I have a lot of women in menopause or perimenopause that are my viewers, and sleep is oftentimes an issue. Are there any peptides that can address that?
Yeah, the ipamorelin CJC can help with sleep. And there was another peptide. I don't want to say the wrong word, but there is one that helps with sleep. It will come to me and I'll let you know.
But so that is possible. It is possible to affect sleep, even if somebody has dysregulated hormones. It is possible to affect sleep with peptides in a positive way.
Yes. I have a nice podcast I did with this guru, right? Ryan Smith, who started the tailor-made pharmacy, probably one of the first, I don't know if it's the very first peptide pharmacy in the country. Brilliant man. So I did a podcast with him about peptides. I think, people may find that very helpful.
I saw that podcast. It was very fascinating. But since you brought up the compounding pharmacy, I think one point we have to stress is don't just go on the internet and get some peptides. I have made that mistake a couple of years ago because you don't know what you're getting. So go through a doctor, get some guidance.
Well, that's a whole other subject as far as pharmacies and peptides, and there's a lot of actions that are not very friendly to these pharmacies, making it difficult for them to provide peptides. So it's just getting harder and harder to get them. Eventually, this is all going to change, but I think of it as a dying snake thrashing around. That's the entity, the traditional medicine entity, not wanting new things to come in. Of course, who suffers? It's the people who are trying to get well. So hopefully the whole thing is going to change soon. I know some really great people who are trying to do things to change the system, to get out of this control from certain, big entities whose bottom line is making money.
Now, I don't really care about that because FDA approved doesn't mean much to me, but are these peptides FDA approved? I'm assuming not.
Yeah, there are a lot that are FDA approved. I'm not sure if they're categorizing it almost like a pharmaceutical, so their regulation is even stricter. So just because it's FDA approved doesn't mean that it's great news for you. And what's funny, I was just talking with another doctor who was getting these stem cells from an FDA approved company. So apparently this company was sending doctors, they're able to sell stem cells legally, but it's so exorbitant. The price is so high. She had to charge $100,000 for a treatment to be able to cover the cost. So just because you got FDA approval doesn't mean it's a boon, doesn't mean it's actually better for you as a consumer. It may get way more expensive because it takes, in general, to put a drug on the market, it takes about $2.1 billion. So you don't think these companies will want to recoup all that money? And where does it come from? From you. So this is why, I recommend people watch that documentary. It's called Unnatural Selection. So unnatural selection is about gene therapy. So you're selecting, you're changing, what evolution has produced. And the treatments were FDA approved. So, and one of the treatment, I forgot either is for the muscular dystrophy or for the eye disease, the treatment is $750,000. Wow. So per treatment. And it's a little vial. They inject you with a little vial. It looks simple, but it's $750,000. Yeah, it's FDA approved. Does that mean it's going to translate to you being able to get it?
Yeah. Well, this was fascinating, Dr. Kong, and I can't wait till I live in California again and I can visit you and get some stem cell injections.
Yeah, we have all kinds of amazing stuff. We just incorporated aesthetic service. So we have this best laser machine in the world. It does many things, right? Face tightening, it basically, you don't need facelift anymore. I mean, I'm sorry, plastic surgeon, and hair restoration and, vaginal penile rejuvenation, scar reduction, pain relief. I mean, it does so many things, even for sleep apnea. The applicator is able to tighten all the tissue and enhance the airway. So, we have, and then in conjunction with stem cells and peptides, right? We're really supercharging the healing process. So when we do any procedures in the face or hair or anywhere else, and we give the stem cells tend to be attracted to the micro injury you just produced. And then that really amplifies the healing process. Everything is all coming together, right? Beauty, healing, and then acceleration. We do some fun stuff.
That's incredible. Well, I'm super excited to come see you. And thank you so much for being here.
You're very welcome. It's been a pleasure. I enjoyed the chat.